So, Sister Alisha, I will now turn things over to you to begin your part of tonight's presentation.
Thank you. Assalamu alaikum, everyone. I hope that you're having a good evening. Thank you for having me back and allowing me to talk about this topic, which obviously I feel very passionate about. Last time that we were here, or that I was here, we did like a general overview of mental illness. We talked about what some examples of a mental illness diagnosis would be and some of like the symptoms of those. Tonight, I want to elaborate on that a little bit further and kind of talk about what, like some ways to maintain mental well-being just overall. So you might not necessarily be experiencing a clinical depression or anxiety, but just to lift your spirits every now and then, or to help you come out of a hard time. What are some tips and tricks for that? A quick recap of depression and anxiety, only because these are the most prevalent mental illnesses that we face. It's kind of every therapist's bread and butter, I'd like to say. And I just wanted to recap some of these symptoms so that you're aware of what they could be for yourselves and for any loved ones in your life. Depression is the first one. So again, it's feeling emptiness or sadness that just simply you cannot shake, reduced interest in activities you used to enjoy, lack of energy or constant fatigue, like a constant tired feeling, irritability, poor hygiene, having some sleep issues that has to do with either sleeping too much or too little, lack of appetite and lack of concentration. And then to recap quickly on the symptoms of anxiety, anxiety is noticeable when there's a persistent or excessive worry. And even when you're trying not to worry about something, you find yourself worrying about something, feeling restless, feeling on edge or easily fatigued or irritable, kind of snapping at people easily, difficulty concentrating because your thoughts are very preoccupied with worrying, and oftentimes muscle tension or problem sleeping. So you might experience tension, like clenching of your jaw, tension when you wake up, or pain in your jaw. Sleeping, you'll feel a lot of anxiety on your neck and your shoulders. You kind of sleep with some tension in your body. And just overall, remember that depression itself is a preoccupation with the past, and anxiety is a preoccupation with the future. Clinically, it's very common for these two disorders to occur together, but just to reiterate that it could be chronic, so something that you experience for a long period of time over the course of your life, or it could be situational. So just because you're facing a hard time in your life, you're experiencing some of these symptoms, if not all of them. So the next slide would be on when should I be concerned about these symptoms? Some things to look out for before we start diagnosing ourselves. I want to make sure that everybody understands that you have to first rule out any physical ailments. So make sure you're staying on top of your doctor's appointments. You're getting your blood test results, because some of these symptoms can be brought on by hormonal imbalances. For example, hyper or hypothyroidism causes a lot of the symptoms of depression, the fatigue and sleep issues and appetite issues, for example. So make sure that physically you are doing okay before you start thinking that there might be a mental illness going on. But also notice when these symptoms start to interfere with your daily activities. You are not able to, enjoy the things you want to enjoy. You don't want to go to the places that you used to go to. You're having concentration issues at work, those sort of things. You're avoiding friends. You're not going to family events. notice that there's an issue if there's significant weight loss or weight gain in a short period of time. And that is usually within a 6-month period if you are not trying. So if you're not trying to lose weight or gain weight, and there's just a significant change in your weight, or if you just simply no longer feel like yourself. I don't know what it is. I can't put my finger on it, but I'm just not feeling like myself and doing the things I once was able to do. So then what if you experience a loved one having some of these symptoms? How could you talk to them? I know this is not an easy topic to bring up with people, even if they are close to you. But just some pointers. First, start off with talking about the changes that you've noticed. I've noticed that you're sleeping more. I've noticed that you're not, staying up to date with your haircuts, or you're not, washing your clothes. Like you notice a hygiene problem. But come at them in a very supportive, I want to help sort of way, not I'm trying to criticize you sort of way. Oftentimes starting a sentence with "you should" turns people away. So start the sentence with "I'm concerned about," "I noticed," "I wanted to ask you about," and kind of go about it that way. Next, offer solutions. Don't just talk about the problem. Don't sound like you're complaining to them about their behavior. Don't talk about how it affects you. Just focus on what you're noticing and then offer solutions. Let me help you. Do you need help with things at home? Do you need help with organizing something? Do you need someone to talk to? The next one would be, do you need help finding a doctor or making an appointment? They have young children at home. Do I need to babysit so that you can go to the doctor? Those sort of things. And then offer to drive them to appointments or help them to set up a telehealth session at home. Sometimes going to a therapist for the first time or a psychiatrist for the first time can be very scary and daunting. Sometimes it might be nice to go with someone and know that they're waiting for you at the end of that appointment. Or that person just might not be technologically advanced. So they might need help signing documents online or setting up a telehealth meeting at home. So offer ways to help them get to the help that they need. So back to the overall ways that we can maintain mental well-being. I know that you've probably heard the term self-care a lot, especially recently with the pandemic. The pandemic had a significant impact on, I think, the overall mental health of this country, from children all the way up to the elderly. So we've probably heard the term self-care a lot. I wanted to elaborate on that. There are 5 main areas of self-care. And what typically happens is that we might be very good at maintaining one area of self-care, but not so good at maintaining. Sorry, I don't know what happened. But not so good at maintaining another area of self-care. So I wanted to go through the 5 main areas and then have you kind of mentally make a goal at the end of this little section here. So the first section is our physical well-being, our staying physically active, is our physical self-care. This could mean exercising, and that includes simply walking, stretching. We can join a gym or a workout group if you need more accountability to keep up with those things. Playing a sport is a great way to stay physically active, maybe get some friends involved. Getting a massage, eating healthier, wearing clothes that you like are all examples of physically taking care of yourself. The next category is emotionally. So our emotional health and maintaining our emotional health. I think this is one that's easy to kind of neglect. So staying away from social media. We all know that on social media, we see the best of the best. And when we're not feeling so great about our own lives for a moment, seeing the best of the best of everybody else's life is not very motivating, and it doesn't really lift us out of a bad mood. So staying away from social media, turning off the apps for a period of time, turning off the notifications might be very helpful to help you refocus those thoughts. Increasing positive social interactions. So a lot of times when we are feeling down or sad or anxious, these are times when we like to isolate and to be alone. We don't really want to be near people. We don't really want to talk about our feelings, or we assume that because we're around people, we're going to have to tell them what's going on. The truth is, when we're alone with symptoms of depression, even if it's not diagnosable, or symptoms of anxiety, even if it's minor, those symptoms tend to take over and get bigger when we're alone. So being around people that we trust, being around positive people, being around people who won't bother us to talk about things we might not feel like talking about, could be helpful in making depression and anxiety symptoms or sadness or worry feel less daunting. Complimenting yourself when you look in the mirror. Now this might sound weird, but I tell my clients to do morning affirmations, and the idea is that you do them consistently for at least a month. The first week, when you look in the mirror and you're like, I'm smart, I'm beautiful, I'm successful, I'm capable, whatever you need to say to yourself in the morning, whatever is meaningful to you in that moment, the first week of it, you might not believe it. You might think it might sound funny, it might sound weird saying it out loud to yourself. But if you keep going for a month, it starts to change that inner narrative. And if we don't change up the inner narrative, then we get stuck in those down, worrisome feelings. It's kind of like if I keep telling myself my life is horrible, then I'm going to believe it's horrible. But if I keep focusing on the parts that are going well, then I'm going to believe that things are going well. The next one is watching or listening to things that make you laugh or feel happy. Also, a lot of times when we're not feeling so good, we might watch a sad movie that makes us cry, or a TV show that evokes a lot of emotions, or we might look at old pictures that make us reminisce on times when we were happier and feel worse about today. That's counterintuitive to really what we need to be doing when we're feeling down. So look for things that would make you laugh, look for things that give you a happy feeling instead of wallowing in the sorrow. The next area of self-care is psychological. So psychologically managing our thoughts. Part of this is setting boundaries, saying no when you simply feel overextended, when you really can't help to the capacity or do something to accommodate someone else's requests. Being able to say no is a big one. Learning something new. So when we're engaging our minds in an activity, we're learning something new, we feel enlightened, we feel good about ourselves. So learning something new helps with our psychological well-being. And then paying attention to your surroundings. This ties into a concept called mindfulness, paying attention to your to the nature around you. So for example, if you're going for a walk, don't go for the walk and not notice something new in your neighborhood, or not try to feel the breeze or notice the trees and the nature outside. That helps to slow down some worrisome thoughts a lot of times. Also, if anyone's working from home, I think it's very important to find some time to go outside every day, even if it's 15 minutes. I know it's hot, but even if it's 15 minutes to kind of walk outside, get a different sense of scenery from the workday to the evening, since we're working in the same place, a lot of us now, make it a point to go outside and get some fresh air. The next section is about spirituality. So making sure that spiritually you are doing well. This can be getting more involved in religious activities or events. I know, like, some we had for the pandemic, we had a big gap in our events and our activities. I'm sure those 2 years where there was no iftar, the Ramadan just did not feel the same. And now that things are opening back up and trying to get back more to normal, we need to make an effort to go out to these events, things that you once enjoyed, things that you used to like being involved in, to get involved once again. Volunteering, giving back, or donating in some way often helps for just feeling more spiritually connected. And then engaging in inspirational videos. So looking on YouTube, or Yakin Institute is one that I like to use, and just has a lot of quick little like talks that you can listen to on the drive to work, on the drive to the grocery store, that help you feel more spiritually connected. Spirituality is definitely a strength, and often we use it as every therapist will use it as a tool for someone who is spiritual in therapy to help them find that strength once again. The next section is professional. So a lot of times at work, you find yourself like stuck at the desk or working in isolation. Sometimes we need to take a break, walk around, chat with coworkers. And in the office, we try to, in between sessions, we try to find each other just to say hi, how are you, how's your day going? It might be 5 minutes that we have in between sessions, but it really does help to get out the office and then chat with somebody before starting our next session. Scheduling a lunch break and stepping away from the office. If you're one that tends to work through lunch and never really take a break, that can be really exhausting. If you're having a bad day, if you're feeling low that day, make it a point to schedule a break, step away from the office. If you can go outside and have lunch, even better, but make it a point to do that. And then continuing education. So as professionals, there's always something else to learn. There's always more information to gather. I know when I go to a training and seminar, I always leave feeling more attached to my profession and more inclined and more ready to do my job. The key here is to find a way to tap into each one of these sections and to maybe make a goal for yourself. So like tomorrow, when you get this information or this PowerPoint from Brother Riaud, to look at each section and kind of say, okay, physically, what goal can I set for myself? Emotionally, what goal can I set for myself? Psychologically, where can I do better there? Spiritually, how can I enhance that feeling? And then professionally, what can I do? And if you set one small goal in each area, check back with yourself in a month and see how you feel with regards to your overall mental well-being. And then if you find that it's time to seek professional help and you want to talk to a professional or a doctor about how you're feeling, that doing it on your own is just not enough, and that's perfectly fine. Here are some contacts that I kind of gathered to share with you guys. So Psychology Today is one where you can put in your zip code. It shows you lists of therapists and psychologists nearest to you. It shows you what areas they specialize in. It shows you what insurance they take and how to contact them. So that's a major source of information right there. I was looking for other Muslim mental health therapists. found one that is licensed. I'm picky on the information that I give you. I don't want to give you information for someone who is not licensed or someone practicing outside of the state, because that would not be ethical for you to see them. So Natasha Haroon is the only one that I found within the state of Florida that's practicing in a private practice setting. I think she's working through telehealth only, but you have her email there if you wanted to reach out and see if she has any availability for therapy, or if you wanted to pass this information on to any loved ones. And then caring therapist is where I work. So the information to email the ladies who handle my scheduling is there. And then some of you probably know Dr. Latif. He is a great psychiatrist. His office is in Tamarack. He and I often work together and collaborate with the patients we have in common. If you want to work with a doctor and possibly get some medicine help with how you're feeling. Also, if you can't, since Muslim therapists are apparently so hard to find, if you cannot find a Muslim therapist, I encourage you to get help where you can get help, even if it's not with a Muslim therapist. A properly trained therapist will take the time to get to know your culture and get to know your background, so as to not give you suggestions or advice that you will not follow. And you can supplement the spiritual side of things. You could, by talking to an imam, going to online lectures or classes, attending religious events. You can enhance your spirituality side and then sort out the negative thoughts with your therapist on the other side. Okay, Brother Riaud, that's all I have for tonight. So I'm going to throw it back over to you.
So I'm just going to take the next few minutes to go over 12 points. And this is just a summary of the article. I will send the entire article in the email tomorrow. I encourage you to read it. There's lots of good examples there of each point that that they present. And so you can read through it and learn more about mental well-being. So I just found this quick slide I want to show you. It says it's okay to take a break, ask for help, grow as a person, ditch toxic people, have bad days, and say no. Sister Alisha covered a lot of those in her presentation. So you can see it being repeated in many different perspectives. So I wanted to share with you this email. I got this email a couple of weeks ago. It's from someone in our class. I edited it and removed any sort of information that may identify the person, but it was sent a few weeks ago before this class, and I've been trying to get it into a class for the last few weeks, but once we saw this topic coming up, I decided to hold on to it and use it within the presentation. And again, as we read through this email I got 3-4 weeks ago, you'll see a lot of similarities between what Sister Alisha has just presented. So I'll read it to you. I know the print is small. It says, "Salam, my brother Riaud. Thank you so much for your kind sentiments, advice, encouragement, and most of all, not judging. Despite the fear of the stigma, I'm glad I reached out to you. I think there were a combination of recent events that brought on me feeling down and depressed, grieving the loss of relatives overseas, unexpected death of a good friend's husband, stress of working 2 contract or seasonal jobs for 4 months, both of which ended about a month apart, causing me to go from being super busy to all of a sudden having nothing to do for over a month now. Therefore, not having much of a plan, direction, meaning, or purpose in life to wake up to each day. I'm sure there are other factors that played a role, such as isolation, social media, current events around the globe, not having my family here as a social support system, etc. I spent yesterday with an Afghan refugee family that I met at the masjid, providing transportation and support, which was a rewarding and therapeutic experience, especially listening to what they've been through this past year. Upon reflection, I am hoping their ordeal will help me reframe and put things into perspective to find and see a light at the end of the tunnel and truly believe and trust that Allah is testing my strength and sabr. I don't know what I would have done without the Wednesday night Zoom classes, especially now coming out of the pandemic, struggling with my current state of mental health. They've been a godsend, a blessing for me, having something to look forward to each week during these challenging times. P.S. I don't mind at all you reading this letter at the end of our next class in case there's someone else who might be struggling, can benefit from it, like in a support group. So in this one email, we see that a person who has reflected, as Brother Mani mentioned last week, about mentioning with social need and identifying the causes of her mental well-being, and she's also volunteering and she's identifying ways to come out of it. Most importantly, putting her trust in Allah and being patient. When you're tested, you be patient and you trust Allah continuously. So I just wanted to share that with you before I get into to the next part. So these are 12 points that I got on mental health advice from the Quran and Sunnah. And these are just the highlights. Again, please read the entire article and the email I will send tomorrow. So number one, acknowledge the reality and importance of mental health. In Surah Baqarah, it says, and we will surely test you with something of fear and hunger and a loss of wealth and lives and fruits, but give good tidings to the patient. So here we have tests and patience, as was just in that email. So Allah makes it very clear in the Quran that our worldly life will be filled with tests. Every single one of us will be tested in one way or another, including with our own emotions. And one such emotion they mentioned is fear, and fear carries the meanings of dread, worry, and concern. So tests are, they come in all shapes and sizes, and I equate this to just as an example, as a metaphor, to driving a car. You're in your car and driving in a straight line, which is the religion of Islam, and you have lines on both sides of that lane, which are the boundaries, and your job is to stay in the middle of the lane. And as you're driving this car, you have external forces on you. You have wind and other traffic and other drivers. But your job, Allah has told you the straight line. Your job is to maintain that straight line. You may have internal things affecting you. Maybe you're playing with the radio or the air conditioner or your cell phone. So you have things outside the car, inside the car affecting you. But if you truly believe, and as a Muslim, your job is to stay in that straight line. So when something affects you and takes your car a bit to one direction, it's up to you to self-correct and come back into the middle lane. And you have a choice. You have free will. You're not a pre-programmed robot. You decide, if this external force is acting upon me, do I just let it take me off the road, or do I try and correct it and maintain that straight line? So, and again, it doesn't have, it could be, we mentioned here food and wealth, too much wealth, not enough wealth. Both are tests. It could be, jobs, it could be a virus, it could be, these days we have climate change, we have gun violence, we have gender issues. All these are different forms of tests. We've been told as Muslims what is the Islamic way, and it's our way to come back to the middle once all these external forces act upon us. The next number two is turn to Allah and remember that He is with you. And we've heard this many times, including last week when Brother Mani mentioned about why sometimes people feel their dua is not answered. And you're in the Quran, it says, and then your Lord says, call upon me, I will respond to you. And truly, it is in the remembrance of God that hearts find peace. And again, that's a reference back to last week. So Allah is always there. Call upon Him often, regularly, continuously, consistently. And that's part of your test. Are you going to make your dua once and then He didn't answer it and give up? Or will you continue to do it every day for as long as you need to? The third point is to take care of your body. And again, we Sister Alisha alluded to this earlier. In a hadith, it says Abdullah is the brother, and he was speaking with the Prophet, and the Prophet says, Abdullah, I've been informed that you fast all day and stand in prayer all night. Abdullah said, yes, O Allah's Messenger. Prophet said, do not do that. Observe the fast sometimes and also leave the fast at other times. Stand up for prayer at night and also sleep at night. Your body has a right over you. And that's Bukhari. So there you say, you have people who want to fast all day, every day, and stay up and pray all night. Here we have hadith that says, do everything in moderation. And that's the key to life, is do everything in moderation. Do not stress yourself out or put undue burden on your body. The fourth point was take care of your spirituality. And we've spoke about this a little bit already. Spirituality here does not mean the mere fulfillment of our religious obligations, such as the 5 daily prayers, fasting during the month of Ramadan, or paying the zakat. Because one can complete those things without any sense of spirituality or also mindfulness, that, people pray their salah, but they just go through the motions. They're not really connected to Allah. Just go up and down and they don't really, they're not connected. So, but rather the care of spirituality is the constant seeking to the best of one's ability of getting closer to Allah. And examples are offer extra prayers, read or listen to the Quran or a translation in your native language, learn and recite new du'as, stay in touch with family and friends, spend money or time on a charitable cause. Remember Allah by saying Alhamdulillah, Subhanallah, and La ilaha illallah. So, attending classes like these, Zoom classes, at any opportunity, say Alhamdulillah, Subhanallah. When I go to the store, if I find a good parking spot, I say Alhamdulillah, I found a good parking spot. So every little thing, it doesn't have to be a big thing. You anything good happens to you, remember Allah and get those words flowing off your tongue easily. Point number 5 is to seek expert help when you need it. And again, we spoke about this earlier, and we have information for contacts in case you want to go that route. In hadith, it says, the Prophet tells us, make use of medical treatment, for Allah has not made a disease without appointing a remedy for it, with the exception of one disease, and that is old age. There's no cure for old age. But here we are told, if you are sick, seek medical treatment. Especially these days with COVID, people are not getting the vaccines for one reason or another. As Muslims, we are told in hadith, make use of medical treatment. And whatever it may be, to protect your body. Your body has a right over you. It's your job to protect your body. Point number 6 is to make the Quran an integral part of your life. In Surah Yunus, it says, people, a teaching from your Lord has come to you, a healing, what is in your hearts, and guidance and mercy for the believers. So I know Imam Nasib has mentioned many times, make the Quran part of your daily life. Just don't set like you're going to read so many pages a day or so many ayahs. Set a time. It says 5 minutes. Plan to read 5 minutes. No matter how, if it's 2 ayahs you say in 5 minutes, just set 5 minutes every day and to touch the Quran, read the Quran, and get in the habit of doing that in a regular life, in your regular lives. The other ayah says, and the future will be better for you than the past. So make the Quran, make Islam part of your spiritual life, and have faith and trust in Allah that your future will be better than your past. Number 7 was practice mindfulness. That's a term we keep hearing tonight. This was from Hadith, and the man said, "Inform me about ihsan." The Prophet answered, "It is that you should serve Allah as though you could see Him. For though you cannot see Him, yet He sees you." So always be mindful that Allah can see what you're doing. These days we have a lot of reality TV shows where the camera people are following the families around, and everything they do gets broadcast on TV, and we all sit in family rooms and living rooms and we watch them on TV. Just imagine your life as a reality show where there's a camera following you around every minute of the day. And then one day that video will be replayed back and you will have to account for everything that you did and said. So Allah is, you can't see Him, but He's seeing you. So remember the mindfulness of Allah, very, very important. The number 8 is to show patience and put your trust in Allah, as in that email from one of our class participants said. But perhaps you hate a thing and it's good for you. And perhaps you love a thing and it's bad for you. And Allah knows while you know not. So this is in Surah Al-Baqarah. This is very important, that a lot of people want things that are not good for them, and they don't want things that are good for them. So, be careful when you make your duas, because you may make a dua for a job, and you may make a dua that I want this job, but that job may not be good for you, and Allah may not allow that job to come in your direction. You may say, "Oh, I made a dua, Allah didn't answer my dua," and then you lose faith. Always, when you make duas, always make it so you always ask Allah to, whatever the outcome is, to make it of benefit to you. Make it the most beneficial for you. Because if you make a dua using those words, that, I applied for this job, and whatever the outcome is, make it the most beneficial for me. If you get the job, great. Dua is answered, and it's the most beneficial way. If you don't get it, then as a Muslim, you say, okay, I didn't get it. It wasn't the most beneficial thing for me. Maybe there's something better. My future is going to be better than my past. So be careful when you're making your duas. Don't ask to be a millionaire. Don't ask to have the biggest house. Ask for better knowledge of religion, more patience, and things that are most beneficial for you. Those are important things in when you're making your duas. Number 9 is to check your consumption information. And we talked about this on one of the slides. Consumption of information is, social media, news, and this is a dua. It says, "Oh Allah, I ask you for knowledge, which is beneficial, and sustenance, which is good, and deeds, which are acceptable." So there's a short dua that, those are the things you need to do. You don't need to follow everybody on Facebook. You don't need to be up to date, and people have this, what they call fear of missing out. If you have, again, the Sister Alisha mentioned, a lot of negativity around you, you need to eliminate that. You can unfriend people, unfollow people on Facebook. You are in control of that. You can decide who you follow and who you tell stories to and who you listen to. If someone who's always calling you, all they do is gossip, if they call, don't answer the phone, because all that is doing is bringing more negativity into your life. And that leads to number 10, which is favor the presence of positive people. The example is of a good companion who sits with you in comparison to a bad one, is like the musk is that of a musk seller and a blacksmith. From the first, you would either buy musk or enjoy its good smell, while the bellows of the blacksmith, you would either burn your clothes or your house, or you get a bad, nasty smell thereof. So who you hang around with, who you deal with, who you socialize with, those are the scents, and this musk or smoke that you will smell like or look like. So choose your friends, choose yourself friends carefully. Number 11 is give. And again, we spoke about this earlier. Sister Alisha mentioned this. Enjoy, every joint of a person must perform a charity each day. Each day at the sun rises. To judge justly between two people is a charity. To help a man with his mount, lifting him onto it, or hoisting up his belongings onto it is a charity. And the good word is a charity. And every step that you take towards the prayer is a charity. And removing a harmful object from the road is a charity. So every good deed that you do almost is a charity. And the key thing is to look for good deeds. If you go and you're mindful of good deeds and wanting to do good deeds to please Allah, you will find good deeds. Here it mentions moving an object from the road. Well, it may not be you driving on I-95 and you stop and you move something off. It could be, again, going back to the parking lot of a shopping mall. People leave shopping carts in the middle of the parking spots all the time. Park your car, move a shopping cart out of the way so someone else who comes after you will have a parking spot and not have to worry about moving the cart. Always think of the next person. When you go to masjid, park properly, park carefully. Always think of the next person parking next to you. When you're in the masjid and you're making your lines and your safs, sit in a way that if someone comes in late, they have room to sit next to you. Don't take up 4 or 5 spots and then everyone is, out the door because there's not enough room. Sit and park and do things in life and look for good deeds. It's not that hard if you're conscious and mindful of doing it, smiling, being nice to people. And the last one, number 12, is think as a community. You see the believers, as regards to their being merciful among themselves and showing love among themselves and being kind, resembling one body. So that if any part of the body is not well, then the whole body shares the sleeplessness or the sickness and the fever with it. So we think as a community. If one of us is not well, we support it. As we mentioned earlier with Sister Alisha, it may not be us in this class. There is professionals that you can seek help with. And if you see someone sick, you offer the help. And as well, if you're not feeling well or someone approaches you and says, I've noticed this about you, be receptive to their concern. Don't be defensive and say you don't know what you're talking about. Listen and work together and solve this together as a community. So with those 12 points, the takeaway is the Quran and Sunnah offer us a practical and reassuring guide to help cope with mental health issues, no matter to what degree, but also to help others around us who might be in more difficult situations and need our support. So we need to help each other and stop judging each other. And when we see somebody, we first thing we want to do is when we see someone sick, we say, okay, hope they take care of themselves, and we kind of push them aside. Or if we see someone successful, we're not happy for them. We want to, you want to pull them down to your level. We need to be happy for people who are successful. We need to be concerned and help for the people who need our help. So that brings an end to my little part here. I just wanted to leave with this one quote from Malcolm X. And he says, when I is replaced with we, even illness becomes wellness. So illness becomes wellness when the I is replaced with we. So we work together as a community. This class, as I've said in the past, has become sort of a little support group, not on purpose, but we're here to help each other as a community, bringing people from many different parts of the continent. And I'm very thankful for all of you that do come and support this class each and every week. So with that, I will bring to end the presentation part. So I'll say Assalamu alaikum. And